Okay, everyone, so let's talk about applying that tourniquet to another person. Like I mentioned, that one-armed application will usually only come into play if you're putting it on your own arm. If you're placing it on your own leg, it'll be very, very similar to what you're going to see here. It would be similar to putting it on another person. So there's a couple of different scenarios where we're going to need tourniquets. One is when we're in a threat environment. So if there's still combat going on, we don't necessarily have time to cut clothes and expose wounds. So we're going to take these tourniquets and we're going to put them high and tight on limbs. Okay, we can see here that our patient is bleeding, but we can't necessarily identify where it's coming from. So we're going to put our tourniquet nice and high and tight on this patient's leg. Same thing would apply if we were going to place it on their arm. If we had an arm injury we couldn't identify, we're going to put it nice and high and tight. If we can see the wound, then all we need to make sure of is that we're about 3 to 5 inches or 1 hand length above the injury. The other thing we need to take care to do is to avoid joints. All right, so vessels run through joints and we can't compress them. Like I was saying, a tourniquet is indirect pressure, which means we need to squeeze the vessel against the bone. And when we're in that threat environment, the best way to do that is to go nice and high and tight. So we want to make sure that it's actually a deadly bleed. You know, should we be moving versus treating? So like I said, volume or just good clinical judgment. If you think you need a tourniquet, use it. Next thing we want to do is double check that the patient has nothing in their pockets. You guys are also dealing with things like gun belts or holsters. All of that stuff can get in your way. We can put a tourniquet over a little bit of clothes, but we can't put a tourniquet over a lot of clothes. In cool weather or cold weather, when you have a lot of layers, we might have to remove those clothes before we can put a tourniquet on, because it's simply not going to be able to put enough pressure on that vessel to stop the bleed. Okay, so we have to keep in mind what the patient is wearing, and we got to make sure that there's nothing in their pockets. So quickly check, because even something so simple as a phone will prevent us from getting that pressure we need. So let's try this out with the soft T tourniquet this time. Now, we've set this up nicely to be deployed. It's going to go into a nice clean ring. We have a couple of options. We can loop the tourniquet around the patient's extremity, but quite often this will just end up with it getting snagged. If we're on the gravel or the asphalt, it's going to catch. So our best option is to unclip it, run the tourniquet under a natural hollow, like something around the knee, bring it up high and tight into the groin. Like I said, we got to get this thing on quick, so we're going to go high, tight, over, close. We're going to secure our buckle. Next thing we can do, because this is stressful, this is hard, we can do a nice big overhand grasp of that rod, and then we're going to pull the tourniquet tight. One of the biggest, or probably the biggest problems with tourniquet placement is that people don't pull this strap tight enough. If we don't have this tight, there's not enough space in the rod and windlass or enough room to really crank that down. So if we're loose here, we're going to have a problem. So we want this as tight as possible. If we can, keep that rod and windlass to the outside as well, because if it's on the inside, it's very difficult to turn. So keep it to the outside. Now, once it's on, we're going to start turning. And like I said, we're going to go until the bleeding stops, which might be difficult to assess with clothes still on, or we're going to go till we can't turn. And we're going to try to give it one more. Now, our soft T has a securing mechanism that's like a D-clip, and then they have a secondary, which is this triangle. We want to capture both of those whenever possible. You'll see that there's no Velcro here, so we're nice and secure. Tuck this tail away so it doesn't get caught on anything, and our tourniquet's in place. Now, let's talk about if we're able to, we have the time and space to expose the wound and have a look at exactly what we're dealing with. So we can see here that we got a bit of blood on our patient's leg, and we want to place a tourniquet just distal to that. So now, what we can do, and we'll get this out of the way just so nobody gets confused. So now we have some time and space to, take a look exactly where our injury is. So we can do that just by cutting some clothes. Now it's important when you cut clothes, and we'll talk about this a little more when we get into hypothermia. When you cut clothes, just follow seams, okay? We don't want to start hacking clothes right up the middle because then it just turns into a giant disaster. So from this side, I'm just going to cut along this inside seam. And, oh, there we go. We've identified our wound. Okay, so now it's important that we've identified exactly where it is. Is it life-threatening? We want to make sure that our tourniquet goes at least 1 hand width or 3 to 5 inches above. 3 to 5 centimeters. And now we're going to place that tourniquet next to skin. Tourniquets work better when they're next to skin. So whenever it's possible, we want to make sure that they're next to skin. It's not always the option because we may have to do that high and tight placement in a threat environment, but when we have the time and space, let's get them next to skin. So for this application, let's use our SAM XT. So we've got our nice loop for deployment. This might be a good time to simply place the tourniquet around the patient's leg. Again, we find our strap. Nice big grip on that rod because we're going to be nervous. We need to make sure we stay away from that knee because we cannot compress joints. And we're going to pull nice and tight on our strap. Now the SAM XT actually has a feature where these two teeth are going to engage. That means that our strap is pulled tight enough and it will actually stay secured. We'll bring the Velcro around. And now we want to start cranking. So now we can visualize, because the wound is exposed, if our tourniquet's actually effective. So we want to go as tight as we can, plus 1 more. This tourniquet has only the 1 securing ring, but we also have the Velcro, so it's important that we bring that through and then secure the strap. Another thing that's important, if we can get it done, is all of these tourniquets have a space to mark the time that they're applied. You can see on the SAM XT, it's in the same place as the CAT, just on the securing Velcro. And then on your soft T, it's just further down the strap. Now, let's talk about tourniquets that are ineffective, okay? So say we've put this tourniquet on and our bleeding doesn't stop. Oh geez, what are we gonna do? We just might need to use a second. So what we're gonna wanna do in those circumstances is we're gonna put one proximal or away from the injury in order to add more pressure. So we can't go over the patient's knee, right? So what do we need to do? Well, we're gonna go measure the same distance away from the knee as we would from the wound. So we'll make sure that we go a good hand width above the patient's knee, and we'll place another tourniquet. This time we'll use the CAT. I'm gonna undo my strap for this one, run it through the buckle. Nice big grip on the rod. Pull it as tight as I can. Keep an eye on this Velcro. And we're gonna start cranking. Now, you'll see that my tourniquet started to slide down on my patient's leg. This could absolutely happen to you. All you need to do is stop, reset, and go higher. We never want to do a treatment that's wrong. We're better to stop, fix it, and do it right than just have it done and do it wrong. It doesn't do our patient any good. So we're going to go just a little bit higher, get that Velcro secured again. We're going to start turning. Lost her there. Now, as you can imagine, this is going to be incredibly painful for your patient, so it's important to talk to them. If you have the ability to talk to a medic to get some pain control, that's going to be very important. But just tell them that this tourniquet is going to save their life. That is also why we just don't want to put them on anyone, because we don't want to hurt people or place tourniquets on people who don't need them. Now again, we'll secure the Velcro, and our tourniquet looks pretty good there. Okay, so that kind of shows the best way to put a tourniquet nice and high and tight. You'll notice that if you have a really, really high and tight tourniquet and it's not effective, you don't have any space to go higher. So you're gonna have to use some good clinical judgment to decide if you need to expose that wound and get your tourniquet next to a little bit closer to the injury, or if you need to move, create yourself some time and space in order to do that. Awesome.